So now she reached out to me. She wants to know, when is she going to get her tummy back? One of my subscribers reached out to me and she wants to know when she will gain back or her non-pregnancy tummy. According to her, her tummy used to be very flat, but now that she gave birth 3 weeks ago, she's expecting her tummy to have returned to non-pregnancy state. Welcome back to my channel. My name is Iyabo. If you're coming across my video for the first time, you're on the right channel. In today's video, I'm going to be discussing on how to get a flat tummy back after delivery. When a woman delivers, it can be in different form. One is by a woman pushing out the baby by herself. Another one is by the healthcare professional assisting the woman to deliver the baby using some types of instruments or even abdominally by cesarean section. So when a woman delivers, like my subscribers that reach out to me, she wants to get her tummy back in 3 weeks. When a woman delivers, it depends on the method that is being used to deliver. So, but whichever, when a woman delivers, first of all, what she should focus on is on how to recover from that stress of pregnancy and going through labor. So getting flat tummy back after delivery, I will advise that first of all, childbirth, it takes time to recover from the stress of giving birth. At least a woman should give herself 6 to 8 weeks after delivery before she can start worrying about her tummy not going back to the non-pregnancy state. Remember, before a woman gets to that stage of that size of the abdomen, it's not just in 1 week or 6 weeks or even 3 months. It takes at least not less than 9 months. Some get to 9 months. Majority of women get to 9 months. But before we talk about full-term baby, we say 9 months, right? So for a woman to go through this increase in the abdomen for 9 months and she wants to, in 1 week, get it back, is not achievable. Okay? So a woman to get her flat tummy back is very important that she focus on her health, general health, okay? And ensure that she gets it right, that it takes time. Take patience, okay? Patience and effort to get back the flat tummy. How is it gonna be? One, we always advise that after giving birth, a woman should breastfeed her baby if it is not medically proven that she cannot. So by breastfeeding a new baby, it helps to burn calorie and further helps to shrink the uterus, which is the womb. You know, after giving birth, we have stages of how the woman shed out the remaining content in the uterus, which is stage by stage after delivery. So during this process, it's called involution. When the uterus is going back to the non-pregnancy state, it takes time. And what helps at this time is when a woman breastfeeds properly, when she adequately, exclusively breastfeed her baby. It helps to make her gain back her flat tummy. Another thing that a woman that's delivers and want to gain back her flat tummy is advised to do is to stay rehydrated. You know, we always talk about rehydration, even when the woman used to be pregnant. Now she has delivered. Yes, she still have to continue being hydrating herself. That is, drinking plenty of water. When she does this, it helps her to lose weight and help her skin elasticity, toning her skin back. So rehydration is very important when a woman is looking at getting her flat tummy back after giving birth. Another way a woman that want to gain her flat tummy back is by exercising. She have to start gentle exercise depending on the the form of her giving birth. That is maybe by cesarean, by instrumental, or pushing out the baby, that spontaneous vaginal delivery, depending on how she delivers the baby. But let's say she delivered through pushing out the baby, she still have to start the exercise, gentle exercise, and by doing this, it helps her body for body to circulate properly and toning her skin. And what are the type of exercise she can do? She can start with cardio, like walking. So exercise is very important when a woman wants to gain back her non-pregnancy body and even especially gaining back her flat tummy. So she have to do postpartum exercise that I'm going to make a special video about the different types of postpartum exercises after giving birth. Another thing that she can do is diet. Diet, it is very important that when a woman that gives birth want to get back her flat tummy or her non-pregnancy body weight, she have to make sure that she takes care of what she eats. She have to take balanced diet by eating enough vegetables, eating enough protein, and just making sure that she takes a balanced diet. It's even advised that she can see her dietitian in order to plan her diet for her, but she have to ensure that she concentrate on balanced diet. And when she's doing this, a woman that just delivered also is advised not to eat large meat at the same time. That's eating full bowl of food, it is too frequent, and eating it in large quantity. All of this will not allow her to gain back her flat tummy. So she's advised to eat it smaller in frequent intervals in order to at least help her to manage hunger. Another thing is to avoid processed food. Is it possible? Yes, it is possible. She should avoid processed food. If a woman that deliver want to gain back her flat tummy, she have to avoid processed foods, okay, and have to limit her sugary drinks. All this sugary. She have to limit it. She limit sugary things, and if it's possible, avoid or even reduce the fast food, okay, and also processed snacks. All of this contain so much sugar that is not going to help her for the tummy to gain back the elasticity and gain her the flat tummy that she wants. Another thing that is we normally advise postpartum mothers to do in order to get their flat tummy back is getting enough sleep. Some women will ask, is it possible to sleep, especially when the newborn normally they don't sleep at the right time? So it's possible. What we advise a new mom to do is that a new mom should sleep when baby sleeps. You know, babies, they don't know time. They don't want to know if it's your time to sleep. See our baby here. Now this baby is sleeping. So that's what they do. For a new mom, we always advise that the time baby is sleeping, a new mom should also sleep. That is why we advise that when we have new mom, you should have someone around that can help with house chore, especially the first 6 weeks. Okay? So that time that the baby is sleeping is also advised, because it may be that throughout the night, baby didn't allow her to sleep by breastfeeding or just crying, because baby also, they are trying to adjust to the new lifestyle, to the new environment, because they have been inside the uterus. In utero life is different from outside the uterus. So they are trying to adjust to the new extrauterine life. So with this, you have to also balance it with the baby. So when you don't sleep, when the new mom don't sleep at night and baby is sleeping during the day, what is expected is that a new mom also should lie down. By that time, she can also sleep. So sleep when baby sleeps. Learn to prioritize rest. By doing so, it will help the body to adjust and gradually gain back the non-pregnancy body weight and even getting the flat tummy back. Also, we advise to manage stress. How is it possible to manage stress? Yes, by engaging in some stress reducing exercise, like activity that you can do, like meditation, take a deep breath exercise, and even embark or engage on some postpartum yoga exercises. All of these can help the body to gain back its non-pregnancy state and further reduce or manage stress. Lastly, be patient. Losing weight and getting back the flat tummy takes time. Okay? So it is advised that when a woman gives birth, she gives her body time to recover. After childbirth, at least give your body 6 to 8 weeks after giving birth. And you see, by that time, it will gradually return back to non-pregnancy state. Even some, they use abdominal binder. They use binding to bind the tummy and make it so uncomfortable. Don't do that. Especially goes through cesarean section or some instrumental delivery. You have to make sure before binding the abdomen, make sure that you get the advice of your doctor. Okay, and by doing so, it is not even medically proven that it can let the tummy goes back flat so fast. It's only helps to support the abdomen. You know, when the woman after delivery, the abdomen looks saggy. So by using abdominal binder or abdomen postpartum belt, it only helps to support the abdomen or to make sure the woman have a proper posture. So it does not really show if her tummy will go back so fast, but some still do it, which medically is not it's not proven if it helps, but only helps the woman to get that relief of that weight of the tummy or even feeling comfortable. So it is advised that just be kind to yourself and just celebrate every small victory, stage by stage, week by week. Every victory you achieve in getting back your non-pregnancy state back or even shedding out the postpartum weight is always advised to celebrate every victory, no matter how little. Okay. And if after practicing all the tips that I've been given and the woman still have concern about her postpartum body, she is advised to report to her healthcare professional. Thank you all for watching my video. I want to say a big thank you to my subscribers. And if you are coming across my video for the first time or you have been watching my video and you haven't subscribed, kindly subscribe to my channel. And when you do that, put on your notification bell in order to be notified when I bring the next video. I want to say bye-bye. Bye.